at that point, once I realized, I had struggled for years and years and years, and within a matter of weeks, I had transformed my sleep pattern. As a budding psychologist, I was just like, oh my gosh, where has this been hiding? Why did it take me so long to get to this solution for a sleep problem? And that's when I kind of became an evangelist.
All right. I am so excited to introduce Dr. Glidewell and his book, The 10 Laws of Insomnia, which I did get to skim through. But I'd like to really start with your why, which you do talk about in the book.
Yeah.
What made you really specialize in insomnia?
Yeah. I mean, I had my own struggles with insomnia from when I was just a baby. I mean, my mom to this day, if we're at a party or a family gathering, she likes to tell stories about how I would just never sleep at night. And
do you have a funny one for us?
What's that? No, not really. I guess it seems it's always was more distressing for her than it was for me. It certainly didn't bother me any. Then it didn't stop when I was little. I was a sleepless teenager, and when we hit our teenage years, our body clocks kind of go haywire a little bit and push us towards being more of a night owl. And I think I memorized the whole all of the reruns of the original Star Trek episodes because I was always up late at night, just not sleeping. And then as I became a young man, I entered the Air Force, I got married, we had a child, all those kinds of things. And that's when I really felt the toll of not sleeping, and the trouble getting to sleep or waking up during the night and having trouble getting back to sleep. As everybody knows, if they've had a bad night of sleep, it affects your mood. It affects your ability to be close to people, your ability to just enjoy the things that are good in your life. It really impaired my ability just to be the person that I wanted to be.
Right.
Over the years, I tried medications, relaxation training. I'd seen a psychologist, done a variety of things, and nothing ever really fixed the problem. And so I just continued to kind of suffer. And it really wasn't until I was in my doctoral program learning to become a psychologist, and I had to write a paper on any kind of mental health problem that I chose, and I saw sleep disorders. Exactly, I saw sleep disorders, and I said, "Oh, that's for me." And at that point, that's when I really learned not only about just kind of truly about sleep and sleep problems, but also about what's called cognitive behavioral therapy for insomnia, which at this point is the recommended first-line treatment for insomnia by the American College of Physicians, as well as American Academy of Sleep Medicine, Department of Defense. It's kind of the way to approach things from a sleep perspective. And so I learned about that, and then I started to put in place some of those techniques on my own, and it was just a revelation. All of a sudden, I started being able to go to sleep in a reasonable amount of time. I started being able to sleep through the night and feel rested the next day. And it was just to get to this solution for a sleep problem. And that's when I kind of became an evangelist, so to speak, and said, you know what, this is, especially in mental health, a lot of things we haven't figured out really well yet. We're still some trial and error as far as solving some mental health problems. But as far as insomnia goes, cognitive behavioral therapy for insomnia is very effective. And so I just really focused on that.
Yeah. And I love you really hit all of the, that's not going to work for me in the book. So we're going to try to go through the 10 laws briefly.
Yeah.
But I do encourage people that are struggling with insomnia to get into the clinic or read the full book, because there's a lot of nuggets in here that kind of will combat those inner thoughts that you have
Yeah.
against that.
Could we take one kind of side road for a minute?
Yes, absolutely.
Because I think it's one of the things that's an obstacle to folks really getting effective care for insomnia is that they might try something and it doesn't work, and they say, well, I tried that. It didn't work for me. And so, what I train mental health providers and just individuals in the community is we need to think of insomnia from a stepped care perspective, meaning that many people are going to benefit from something like the book or even some online training and things like that. But there's, 20 or 30% of folks who that's not going to be good enough. It's not going to fix the problem. And the important piece is then you have to seek the next level of care. And, at the Insomnia Clinic, that's one of the things that we try to do is provide this full spectrum of care, starting with educational resources that are totally free. And if that doesn't work for you, then we need to do something a little bit more intensive and aggressive. And if that doesn't work for you, then ultimately, there's a point where seeing a provider here at the Insomnia Clinic is the right thing to do. But for many people, probably 80% of people with a chronic sleep problem, just learning about cognitive behavioral therapy, they're going to get at least somewhat better.
Yeah. So. Well, and you talk about this, but we've, as providers, we get kind of this resistance, this victim mentality. I have insomnia, as if it's I have cancer, right? And it's way more complicated than that. And there's many of these laws that talk about mindset. But let's start with law number 1, how critical sleep is and making it a priority. I don't think people really understand that literally all healing happens in sleep and how this must be a priority for you, regardless of what you're dealing with.
Yeah. I think there's enough research out here about the importance of sleep, both mentally and physically. I think we have to think about sleep as being as important as food and water and air. And when I say that, what I mean is if we don't get either adequate sleep or enough sleep, over time, there's going to be a progressive deterioration of our emotions, our thinking, and our physical body. And when that happens over time, we know that it leads to increased problems with anxiety and depression, increased problems with high blood pressure and heart disease, diabetes. So it really takes a toll on every aspect of our being.
So therefore, the title of law number 1 is sleep is critically essential, and we need to make that a priority. Law number 2, insomnia has many causes, and you talk about things like anxiety, pain, sleep apnea, allergies, asthma, even prostate, body clock or circadian rhythm, menopause, depression, medications, just the way you've programmed your mind, which is kind of mindset. Talk to us a little bit. I think a lot of these we know. Talk to us about prostate and menopause and how that impacts sleep and how you address that.
Yeah. Well, I think to understand prostate and menopause in terms of sleep and all that, everything else on that list, I think it's important to recognize what ends up being the driving force behind chronic insomnia in the majority of cases is that there's a point where it takes on a life of its own. So, at the beginning of the process, maybe there are some hormone changes around menopause that are clearly disruptive, causing hot flashes, night sweats, those kinds of things. Or in the example of prostate, the most common way that shows up is especially men. They're waking up during the night and they're having to go to the bathroom again and again and again. But then what happens is, the sleep problem starts because there's some physical basis for it that's disrupting sleep. But then if you have trouble sleeping often enough over a long enough period of time, there's a point where the brain learns to sleep poorly and the insomnia takes on a life of its own, so to speak. And then once that happens, now your brain doesn't need a good reason not to sleep anymore. So let's say you go to see your urologist and they give you a medication and it calms down your bladder or whatever kind of thing is going on with your prostate. But now you still can't sleep. Or you kind of get through that period where those hormone changes are directly interfering with sleep, but now you still can't sleep. And so that happens in about 90% of cases of chronic insomnia. But one of the big obstacles, I think, to people seeking help for insomnia is they say, well, I know why I'm not sleeping. And it is, well, because I'm in menopause. It is, well, because, I've got this prostate issue, or any of the other things on the list. But, the research pretty clearly shows us now, if you've got insomnia, even if there's other health things going on, if we treat the insomnia, you're going to sleep better. And so that's, I think, one thing that folks, it's helpful to understand is saying, whoa, even if, I've got some depression and insomnia, if we treat your insomnia, not only is your sleep going to improve, but you're actually going to have better outcomes as far as depression. You're going to respond better to other treatments for depression, those kinds of things. Yeah.
Oh, I love that. The next several laws I could kind of sum up in, mindset and, maybe learned behavior or just believing they can't sleep. And I've struggled with insomnia myself. So I was in this period where about a year after my daughter passed and having PTSD symptoms. I'm 50, so there's some, perimenopause going on, change in sleep pattern just because of my spouse currently on hospice. And so all of these things were happening at the same time. And as knowledgeable as I am, pulling the layers and dealing with each of those things took time. And I think as a provider trying to meet people where they are, it's kind of hard, right? They're here for depression. We can refer them back to their PCP for this and this, but, some people believe in hormone replacement, some don't. So the pulling that all together in a sleep clinic just really sounds like a great referral source for professionals as well as people who, this is a symptom on its own that can be treated without medication per se, right? Because they come to us for medication and we know that most of those meds are not good long-term. Right? So let's talk about that medication long-term for sleep and then move into the mindset of I can treat my insomnia.
Yeah. So medications have their place in the management of insomnia. And I think they're a necessary tool in our toolbox, so to speak. The problem being that in many cases, they stop working over time. And there's definitely risks with almost all sleep aids, whether or not they were made for sleep or not. There's a risk of becoming dependent on it, both physically and psychologically. And by psychologically, I mean becoming afraid that you won't sleep without it. And then that becomes a self-fulfilling prophecy if you try not to take it, and so it creates this trap for folks. And so for most people, medications are a great short-term solution. They help you sleep well in the short term to give some relief and just help you to live your life even though you're having this sleep problem. But then, like I said, for most people, they stop working, and then what do you do? And cognitive behavioral therapy for insomnia is very effective in reestablishing a healthy sleep pattern even if someone's taking a sleep medication and it stopped working, it's also very effective. Maybe the medication's still working, but the person wants to get off of it because they're worried that, is it going to affect my memory, especially in older adults? Is it going to cause me to have a fall? Is it causing me to be depressed during the day or fatigued during the day? So, maybe they just want to get off of it. And then cognitive behavioral therapy can strengthen the natural sleep system so that you can successfully reduce the medicine and maintain healthy sleep. And so I think that, one of the challenges in our healthcare system as far as sleep medication goes is that in most primary care settings, that's the only tool they really have available to them. Most primary care providers aren't necessarily familiar with cognitive behavioral therapy for insomnia or how to help a patient connect with those kinds of resources.
Right.
And so it's kind of like, well, I don't want to prescribe this medicine, but I don't have another solution for this person that's suffering here in front of me.
Right.
Yeah.
Love that. So let's get into those mindsets. So here you have law number 4 is insomnia is a tricky problem. Law number 5, insomnia is a power problem. And insomnia is a programming problem and a mind problem. Those are all kind of these internal dialogue kind of things. Elaborate on that.
Yeah. So the issue of it being a tricky problem is if, most of us, when we start having trouble sleeping, we just don't lay there and take it. We want to do something to try to sleep better because it's important. And so maybe we start to do things like, well, I'm going to go to bed a little bit early tonight. So hopefully I can catch up on the sleep I lost over the last 3 nights. Or I'm going to go ahead and
Does that work?
It typically doesn't work.
Okay. It's important that the audience knows that it's a mindset, but it doesn't actually work.
Exactly. And so that's, maybe we go to bed early, maybe we take a nap, maybe we cancel what we had planned that day because we're just kind of too tired because we didn't sleep well. And so on the surface, all of these things make sense, but in the big picture, they actually make insomnia worse. And so when I say it's a tricky problem, that's what I mean. If you're having trouble and you're going to do something to try to fix it, the chances are the thing that makes the most sense is actually going to make it worse rather than better. And so it's really frustrating.
Yeah.
And I think it can be really discouraging for a lot of people because it is so tricky in that way.
Yeah.
Yeah.
Absolutely. And the programming problem. What do you mean by that?
Yeah. So that's, when I was talking earlier about there's a point where insomnia takes on a life of its own. That's really what I'm talking about, is that the brain gets programmed not to sleep. So, maybe the problem started because, there was some transition to menopause or maybe some depression or anxiety or even just stress. But then maybe now there's an expectation or a fear that you won't sleep well, and that fear of not sleeping now causes the inability to sleep. Or you've laid in bed during the night thinking and planning and worrying so many times that now your brain is programmed when you wake up during the night, it automatically starts thinking and planning and worrying.
Shut off. Yes.
And so when I say programming, that's what I mean is now that those difficulties are automatic and they don't need an outside reason anymore. Yeah.
What are some of the first things that you do for clients in the mindset part?
Yeah. Well, so the first part is that, beginning to interrupt that automatic programming, so to speak. And, one of the most common recommendations that people come across is, if you're not asleep, get out of bed. And this...
Do you agree with that?
I agree. Yeah.
Okay.
The way that I think about it is every minute that you lie in bed awake, is a minute that your brain is learning to be awake in bed. So the longer you lay there sleepless, the worse the problem is likely going to get rather than better. Even though sometimes the default mindset is, well, I'm in bed, at least I'm resting. But again, that's a tricky aspect of it because you probably are resting, but it's not going to fix the insomnia.
Well, I always feel like if I get up, I'm going to actually be fully awake and then not be able to get back to sleep at all.
Yep, exactly. Yeah. So there's this, it makes sense. Well, if I get up, I'm going to wake up more. But when you stay in bed, it makes it worse. Kind of that tricky aspect of things again.
Right.
And so that's, in the book, I talk about all these techniques and I talk about some of the ways that our mind tricks us. And for many people, as long as they can kind of understand these things we're talking about, they're like, oh, I see how that works now. They're going to then be able to do the techniques in an effective way.
Yeah.
But sometimes these tricky thoughts or beliefs that our mind gets around sleep, sometimes they get so strong and stubborn that it really is something, okay, we're going to need to work as a team to navigate through this.
Right.
Yeah.
Absolutely. We talk a lot in psychiatry about the 24-hour day. You have a whole chapter on this as one of your laws. I think people, some of this you've talked about of like you take a nap during the day or you rest, but then that is going to disrupt the sleep cycle and how we should, be awake during the day and asleep at night. Can you talk about that 24-hour problem?
Yeah. So oftentimes when we're struggling with sleep, we think it's just a problem at night and we need to focus on the nighttime and solve that and everything will be better. But sleep is something that happens as part of our whole life. And so how we deal with sleep during the day, either staying awake or napping, certainly influences our ability to sleep at night. And I certainly don't believe that napping is inherently bad. But I think we need to use it in a very thoughtful way as a tool. So we just need to be, I think, thoughtful in that respect. But then I think we also need to look at what are the things that are happening during the day that are going to influence our ability to sleep at night. For example, maybe you're in a stressful family situation or a stressful work situation, and you're driving yourself hard for 16 hours a day, and then you try to drop into bed at night. And there's just not been enough time to really, for your brain and body to transition. Or maybe there's some really hard things going on in your life. And during the day, you don't have much time to really deal with those and process those. And so then when things go dark and still and quiet at night, they're waiting for you there. And so I think we just need to be thoughtful about what are the daytime things that are influencing my nighttime and addressing those as well.
Right. Yeah. Caffeine is one, not exercising, and people always think that you have to, do some strenuous exercise, not necessarily just, getting up and walking and being some sort of movement during the day and things like that. So, yeah.
Yeah. I would really put those things like caffeine, exercise, diet into a bucket that I would call like sleep hygiene or healthy sleep behaviors. Those are the things that you can do to give yourself the best chance for a good night's sleep.
Right.
Those, I think, are just good rules for everyone to follow. But when we look at the research, those things aren't an effective treatment for insomnia. Yeah.
Okay.
And oftentimes folks and healthcare providers, they get confused about the difference between healthy sleep behavior and cognitive behavioral therapy.
Yeah.
And so they get a list of healthy sleep behaviors and they do those things and they don't fix the problem. And then they think, well, I've already tried cognitive behavioral therapy. And so oftentimes that's one of the obstacles to folks saying, this didn't work for me. Let me take the next step, because they think that was the end of the road and they're just kind of hopeless.
Yeah. For the audience, we call this CBTI, cognitive behavioral therapy for insomnia. And I can tell you, we do a solid cognitive behavioral therapy here that's not effective for insomnia.
Mm,
So
good
tell
point.
us how this, CBTI is different than just regular CBT.
Absolutely, yeah. So cognitive behavioral therapy for insomnia really has several components. So the first one is manipulating the sleep schedule specifically for the purpose of increasing your natural sleep chemicals. And in most cases, what that means is we're going to reduce the amount of time that a person is going to spend in bed temporarily. And we're kind of using a little bit of sleep deprivation to increase the natural sleep chemicals.
Interesting. I did not know this.
Yeah.
And I've been in practice 20 years, so there's lots of clinicians out there that don't know this.
That's
so
right.
I just wanted to stop and say that and then continue.
Yeah.
Yeah.
Yeah. So that's the purpose. When somebody says, we need to limit the amount of time you're spending in bed at night, that's why. Because when we do that, we're going to change the actual brain chemistry around sleep. And that's going to make it easier to fall asleep, wake up less, return to sleep more easily, those kinds of things. So one is manipulating sleep schedules.
Okay.
The other one is changing how you respond when you can't sleep and changing how you use the bed in the bedroom. That's that kind of get out of bed when you can't sleep, because as I was saying earlier, every minute you lie in bed awake is a minute that your brain is learning to be awake in bed. And that counts during the night if you're sleepless, or maybe you spend an hour in bed reading before you turn out the lights. Both of those times, there's confusion for your brain saying, well, when I'm in bed, should I be sleeping or should I be reading or worrying or whatever? So then, part of cognitive behavioral therapy is that healthy sleep behavior, sleep hygiene, those rules. Another piece is formal relaxation or meditation training. And when I say formal, what I mean is a specific plan for daily practice over time in order to develop a skill in relaxation or meditation. And the reason I say that is because, oftentimes I talk to folks and they say, well, I've played around with the Calm app or the Headspace app or, some app out there, and meditation or relaxation didn't work for me. And the thing that's really important about relaxation and meditation training is when we look at the research, it really takes 6 to 8 weeks of daily practice to really benefit from it. And so cognitive behavioral therapy means working on that formal training with a therapist or in a systematic way. Yeah,
and just to plug in, that's what worked for me is using meditation before bed, and then when I wake up in a panic, to use meditation to get back to sleep.
Yeah.
So just to plug in for that definitely worked for me. So insomnia is a stress problem is your 10th law. Tell us about that.
Yeah, I think I started to touch on that when I started talking about, what's going on for you during the day. Are you going through some hard things with your family or your boss at work or your kids? Are you recovering from an illness? What are the things that are putting pressure on you and on your kind of your mind, your body, and your spirit during the day? And the way that I would think about it, the more stress that you have, the harder your natural sleep system has to work to put you to sleep, keep you asleep, give you restorative sleep. And so stress management, I think, is critical because, the more that we can lower your stress, the easier it is for your body to take care of you from a sleep perspective, meaning that your natural sleep system is better able to do its job.
Right.
So
love that.
Yeah.
So if people live in Colorado Springs or the surrounding area, you have an insomnia clinic. Give us that information and how people can come see you.
Yeah. So we've got offices in Colorado Springs, Pueblo, and Denver.
Okay.
However, we see all patients by video now. So we see folks from all over the state.
Okay. Perfect.
And So you can go to our website, which is just insomniaclinic.org. And there's lots of resources there, educational resources.
Mm-hmm.
We'll also, we're happy to do a short conversation with folks before they schedule an appointment because, most folks, by the time they're thinking about coming to see us, they've already been kind of disappointed by other efforts.
Yes,
and,
absolutely.
Before we ask folks to commit to another appointment, another adventure, we want to make sure that we can help. And so we're happy to do a short phone conversation, either myself or one of our other clinicians, and get a little understanding what's going on for you. And so that we can say, hey, you know what? We think we can help. Let's figure out what the next step is.
Yeah.
Or to be able to say, I don't know that you're a great fit, but let's get you over here. And we think this is going to be the best fit for you.
Yeah. And so with the telehealth, do you have a national vision for the Insomnia Clinic?
Mm-hmm.
Tell us about your national vision. I love to see you grow.
Yeah. That you mentioned training in medicine being a challenge, and so at this point, the big challenge is gathering a group of clinicians who are trained and have experience in doing this, because most schools, whether it be medicine or mental health, aren't doing a great job of training our clinicians. And so at this point, the focus is really growing a good, solid group of folks who can care for people in the right way around this problem.
How do you feel about CBTI apps and those kinds of things?
Yeah. So when we look at the research on CBTI, whether it's a pamphlet, a book, online program, an app, or coming to see an individual provider, if we can get somebody the basic information on CBTI, they're most likely going to get better. Okay. And so I don't care if it's a book or if there's some great online programs, there's some great apps, I'd say do it. And then if you find that you've tried it and it doesn't fix the problem, make sure that you're then still talking to somebody,
next level,
talking to their nurse practitioner or their primary care provider or their therapist, or coming to a clinic like ours.
Right.
Yeah.
Absolutely. Well, thank you so much.